Hopefully you feel like I do. We've been having a great day. We've got another great day planned for you tomorrow. But we're not done. We have a couple of really great presentations for you. We're going to do something that may be a summit first, although we have done this in our leadership big meeting that we have. And that is to actually have a patient engaged in a discussion with us. The first time I had the opportunity to do this was actually with Barbara Wilson's very dear friend, and we recorded that interview with that patient on my blog, and it was actually one of the highest visited blog pieces we ever did. Because the impact of hearing from this patient was so profound. And so for those of you who are not yet familiar with my blog and want to know more about what we're doing here at St. Luke's, there's a card, depending on which side's flipped up on your table. It's either green or white. And that has the website to my blog, and we would be happy for you to follow along on the blog as to what all's happening at St. Luke's. But today, we're going to invite Dave Behunin up to the stage here with me. And we're going to start out. I'm going to interview him. I'm going to have him tell you a little bit about his story. But then we're also going to have time for you all to ask questions. And this can be very, very insightful when we get direct input from patients. And it's part of, if you think back to what Dr. Nash talked about, if we're going to be patient-centered, and he talked about the kind of the novel idea of actually asking what patients' goals or objectives are. We've got to talk to patients if we want to understand how to improve what we do and make our care more patient-centered. So you're going to enjoy this visit with Dave. Dave, come on up. Dave was, is my mic still? Yeah. Dave was born in Utah. And his family moved to New York, but then to Eagle, Idaho. Dave was 12. Hi, Dave.
All right, sir.
Have a seat. Was 12 when he came to Idaho. And he graduated from Meridian High School, go Warriors. And then George Fox University with a business degree. He's been at Hewlett-Packard for 25 years and is currently a project manager working with consumer products. So welcome, Dave. Glad to have you with us.
Thank you, Dr. Pate. Good to be here.
And thank you for being brave enough to share your medical history with 300 of our closest friends.
I believe in the HIPAA laws. You're all welcome to it.
So, Dave, let's just start with a little bit of background. You've had diabetes for about the past 26 years?
Since I was 24, that's when I was first diagnosed with diabetes, yes.
Okay. And then tell us about what happened. It was nearly a year ago, I think in March of last year.
March of last year, yes.
Describe what happened with that illness and how you ended up interacting with St. Luke's.
Okay, so I go to work the morning of March 14th, and two of my buddies, one who had been an EMT and the other guy who is very astute at how, people are, they looked at me and they go, "Dude, you're sick." I'm going, "Yeah, what's normal, I'm always sick, And they go, "No, you look like you should be going home." I go, "Well, I got work to do." And so push came to shove, and about an hour later, I left the office, went home. And of course, my wife, who was going, "Well, why are you home?" Everyone says I look sick, and so I came home. So I'm going to go to bed. I'll just sleep it off. We'll call it good. And so I took about an hour nap, and then I called my dad just to see how he was doing. He goes, "Well, are you at work?" "No, I'm home." "Well, why are you home?" And everyone says I'm sick. "Well, I had a virus last week. Why don't you go to the doctor, get some blood drawn, see if you got an issue?" Okay. So I go to the doctor. They draw 2 of 3 vials. And the doctor says, we need to get a third vial from you, but you're really, really dehydrated. I want you to go home, get as much fluid in you as you can, come back in the morning, and we'll see how things are going. Next day, I'm real short of breath going, and I'd never had breaths like that before. And called the doctor, and he goes, don't even come in. Just go to the ER. I'm sending my stuff over, and I go, well, which one? Because I'm just about halfway either way to St. Al's or St. Luke's. He goes, I'm closer to Luke's, that's the one I deal with, go over to St. Luke's. Okay, I can do that. So my wife and I get in the car, and she drives me over, and get out and walk into the ER, and people are going, hey, how are you? How can we help you? Really friendly, really nice. And I'm going, well, I was told I'm supposed to be here. And they're, well, who are you? And my name's Dave Behunin. Bam, they slip a little wristband on. They say, we're waiting for you. Would you please come over? And basically, I'd been diagnosed with pneumonia and still dehydrated. And the nurse goes, okay, we've got to go through your records. And she starts reading off drugs that I had been on many years ago. And I'm going, oh, no, that's not what I use now. And so I started trying to update the nurse with what my current medications were because, insulin usage had changed, metformins, all these things had changed over the years. And so I'm trying to get her up to date. And she's going, we got to get more blood out of you. Okay, I can do that. Here's the arm. Well, they took this arm and they took this arm. In goes the fluid into that arm, out comes the fluid from this arm. Then in comes the fluid into this arm because I was really dehydrated. So they had it going on both sides. And they said, we got enough blood, we're going to run some tests, we'll come back. And so the doctor's talking with me and tests come back. And I don't know how long it's been, probably an hour or so to get through the labs. And he goes, okay, you got pneumonia and you got sepsis. And I knew what sepsis was. It's a happiness. And he goes, have you been in a hospital lately? No. Have you been around anyone from the hospital? No. He goes, well, you're in a state where we've got to get you fixed. We've got to get some antibiotics in you, make sure that it's not getting into your heart and getting pumped through your system completely. And I go, okay, that's fine. He goes, well, normally we have to put a line into your jugular. I go, well, you're the professional, go ahead and do it. He goes, I don't have this conversation with my patients. They're usually unconscious. Well, do what you need to do, Doc. I'm here with you. Just go for it. And I vaguely remember them working on the jugular on the right side, and the next thing I remember is waking up the next day. And it's like, I recognize that machine, I recognize that machine, and I got a hose in my mouth, something's wrong. And my wife, bless her heart, is leaning over me, you had a heart attack. Really? Okay. Wasn't supposed to happen. But if you got to have one, ER's the best place to do it, I promise you. It's all timing. But, I'm sitting there listening, and I've got 1,000 questions running through my mind, and it's like, I can't ask them. So I motioned for a pencil and some paper. And so they give me some paper and a pencil, and I write down a couple of things. I look at it. Yep, okay, here's my question. My wife looks at it. I can't read this. She hands it to the nurse. I can't read this. I'm looking at it. How bad was it? Morphine is a wonderful thing. You can read your writing. No one else can. So I did this down the page. And the nurse goes, I know what you're asking. No, we didn't have to cut you open. Okay, that gives me a point of reference. They didn't have to crack my chest. We're starting. But over the next few hours, I'm getting frustrated because doctors are asking my wife questions, and I'm going, over here, I can answer that, but I couldn't answer it. And of course, my writing hadn't improved. And so somehow in the communication process, I was able to communicate to my wife, go home. She brings it back, and so she was asking me questions, and I could type out an answer on this little thing. It's like patient size, type it out, all was good. And so this goes on for a day or so, and then I think it was Dr. Fonseca who came in and was asking my wife a question, and she goes, well, he can answer that. He's got a tube in his mouth. How's he going to answer it? And he's got his iPad. And so Dr. Fonseca asked me the question, and I typed him the answer. And he's going, that's genius. And I'm going, Doc, these things have been around 5 years. No one's tried this? But, I mean, to me, and granted, this is the arena that I play, it was blatantly obvious. But it's not blatantly obvious to everyone else.
Right.
And so that was kind of the breakthrough for communication for me while I was in the ICU. I'm not the only one that's experiencing things like this. Right. Deb Compton, who is the head of the ICU over in Meridian, experiencing one of life's bad events, was invited to be part of her son and future daughter-in-law's engagement announcement, but she was in the hospital and couldn't be there. Up comes Skype. She's able to communicate, talk, watch as her son is asking the future daughter-in-law, will you marry me? That's huge. Everyone talks about the Kodak moments in life. We have technology that can make those available, that can break down the barrier of communication simply and affordably. This little device is about $700. After I left the ICU, I wanted to know what I could do to help, because there are other patients that are not going to have that technology at the ready. Well, what if I were able to put a couple of devices in the ICU so that, if someone needed it, here's a cheap thing that I can just say thank you to the hospital. Well, there's a couple in Meridian, there's one downtown, they're being used. After your blog, the doctors are asking for it. This patient could use this.
That's great.
It's starting to gel in a way that, you shove a little snowball, it's a little snowball, but once it gets going down the hill, it gets bigger and bigger and bigger until it's unstoppable. And communication is just that. If a doctor is able to cut 15 minutes out of the discussion because he can get the answer from the patient, as opposed to going, just a minute, I got to get an interpreter. Mm-hmm. Or, Mrs. Behunin, can you answer this for me? What is he thinking? She's going, I have no idea what he's thinking. Let me, that enables the doctor to save time, redirect his time to another patient that might need more time, and so it lessens costs, mm-hmm. and it makes it easier for the doctor, because if he can communicate directly with the patient, there's no interpretation. It's the direct answer. And so that's huge.
Maybe speak for a minute. Of course, the big thing was you now had technology that was readily available that you could use to help communication. But talk a little bit about some of the other advantages of how it helped you with your care and understanding your care by using this technology.
Okay, so one of the great things about St. Luke's is, gee, you got wireless communication there. And the doctors come in, yeah, we checked your troponin, and yep, you're in heart attack mode from here to here. And I'm going, troponin? What is troponin? Oh, it's an enzyme that's excreted from muscle as it's in catastrophic state. Cool. That's cool.
You know, the alternative is that doctors could try talking in English first, but probably we better rely on technology. So.
English is overrated. But, you know, when the doctors would ask me questions, and, you know, you can't just stand there the whole time and explain out everything that is going on. The ability to look it up and then maybe have a question ready for when the doctor came through the next time around, or the nurse came in to say, what's going on, how you doing? Oh, I looked up troponin, and that's kind of interesting, and it shows that this 0.6%, it tells you you're in heart attack mode, and I was 20 times that on Friday, 80 times that on Saturday, and 40 times that on Sunday. What does that mean? Does that mean I'm still in this catastrophic mode? So I could ask the question. For me, from an engineering project manager perspective, that's huge. There's nothing worse than fog. It's useless to me. And no is a correct answer, yes is a correct answer, and there's all sorts of conversation in between. But if I can pinpoint what I as a patient need to know, it's huge. And it's a stress reliever. When we first talked, you go, what kind of fears did you have? Well, I wasn't really afraid. This was really interesting to me, which my dear wife, this is catastrophic to her. She still thinks I'm kind of nuts about the whole thing, but these are the things that fascinate me. And so I want to ask questions. I want to know what's going on and why and how it would overall affect me. And so being able to do research while I was there in the hospital, ask questions that had some sort of meaning to the doctors and the nurses, got me the answers I needed as quick as possible.
Let me just make a comment rather than a question. We had a question earlier today for Dr. Nash, I think, about how do we engage our patients and how do we make them accountable? And I think too often we look to place too much accountability on patients when we haven't really given them the tools or the information to be engaged. And here you're hearing somebody who really wants to know, really wants to be involved in his health care, but we were making it hard on him. We were talking to his wife instead of him. We were not communicating because he was intubated on a breathing machine. We were talking in language he didn't understand. And here's a big opportunity for us to engage patients if we can figure out how to use technology, videos, other kinds of information to help them. Talk for a minute about, there's also some apps that I was told you downloaded that seem to be helpful to you. Tell us about how that worked in your care.
There are actually lots of apps out there. Cardio apps, you know, I was given a book about yay thick. Oh, here's an app. Oh, this is my heart. This is the left anterior descending. Oh, that's the one. It's got a little metal fun thing in it now called a stent. But I could read a paragraph, I could see an image, and that's where the problem was. Okay, that's making sense to me. It's simplifying it for me. I don't have to read, 8 pages of typed out information to say, yeah, we had a problem here. We had blockage. Oh, complete blockage. This is what you need to do to move forward. Oh, by the way, to prevent this, here's some suggested things for a diet. You want to stay in low cholesterol. Actually, I was pretty low on cholesterol. It was only 69 total that day. But if I continue to eat properly, that's not going to be a problem for me. Now, hereditary, that's the other side of the coin, and I've got that in my family. I can't help that one. But I can do everything I can from a dietary app in this. The huge one for me, though, is my chart. One of the nurses, bless his heart, Chaz, we have several stories of Chaz. He kind of took me on as the, dude, you're not going to be alive, but hey, I'm going to work with you.
I hope he phrased it differently. What is Chaz's last name?
Actually, he would never give it to me, and if he did, I wouldn't give it to you, Dr. Pate. Actually, he probably one of the best friends that I had for that 10-day period. Guy was very astute, took several for the team on your team's behalf. But he goes, let me hook you up with my chart. And we can start getting you to where you can see what's happening. When I run a test or someone else runs a test, you can just go and look at the test and then you can create your question. I'm going, sweet. Cool. And so if you got patients, get them onto that. I swear it's going to be the best thing for them because they're going to be able to communicate better with you. But it also gave me something else. I've got my cardiologist over in Meridian, and I got my cardiologist downtown, and I got poor Dr. Christensen, my endocrinologist, here on 11th. And his staff were going, wow, you had a real neat spring, didn't you? I go, it was pretty exciting. And we see you got all these new meds, and they're having this effect on you. And they actually had the list when I went in. I didn't have to go, let's see, I'm on this, 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 and this. And, oh, yeah, Dr. Cal Smith and Dr. Costello said Plavix and the 81 milligram aspirin every day religiously, forget everything else. Those two have to be done. I was able to go, this is my package. This is what I'm on. It was huge.
Let's talk for a minute. We've talked about your inpatient stay. What we're talking about with this group of folks is population health management and how we care for patients really across the continuum. And you're a great example of a patient with a chronic disease. You have diabetes. Now you have heart disease. And these are a group of patients that we have an opportunity to coordinate their care better. And so let's talk about kind of the ongoing treatment of your chronic conditions and the use of technology. And maybe you can talk about, there was a study talking about patient preferences for accessing their online medical records, for being able to email their provider, for being able to schedule patient appointments online, and their willingness to actually change doctors in some cases to get those kind of things. And the focus of your work is on consumers, products from HP for them. Tell us about how important this is in terms of your engagement as a patient, your care coordination, the ability to effectively manage your medical conditions.
Okay, so I don't know if Dr. Costello is here. If you are, I've got an appointment on the 9th of April at 3:30 with you, and I found that out from my chart when I checked it this morning. I can go in, I can see when my appointments are, I know who they're with, I know whether they're with a doctor, the physician's assistant, whoever. And I can make sure that it's on my calendar, And if my calendar's blocked, I can send an email back that, this isn't going to work. Can we reschedule? I've had to do it twice, and I had an answer back in 15 minutes. This is the new schedule. Does this work? Perfect. And oh, by the way, I have this question. I don't have any chest pains right now, doctor. Everything's going really well, but I'm not sleeping well. Can you respond on that? And that was in the first couple of weeks of going home, because I wasn't sleeping real well. Boom, had an answer back. How are you setting up or laying down when you're sleeping? Well, I'm kind of reclined. I'm in a recliner. Try this. Boom, work. So it's instantaneous, and it's not get the doctor on the phone. It's an emergency. The doctor's got patience. The doctor has to do things right there at hand. But when he's passing through, he can check and see, oh, there's an email. Oh, okay, this is from Dave. Beep, 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 boom, gone. And he's back to what he's doing in a minute, minute and a half. Again, it is a way that the doctor can deal with a patient instantaneously, minimal time consumption, and it's effective.
Another thing I think of in terms of our future use, and I don't think that future's very far away, and Dr. Nash spoke this morning and told us about some of Dr. Eric Topol's views on the use of technology for patients. And I think about your case with diabetes, and I think that we're so close to where we could have our diabetic patients having glucometers at home that upload results to their MyChart, and that we could even set limits that if the blood sugar was out of the limit, that it would alarm me or my nurse practitioner or PA. In fact, my guess is that if we looked back to the couple of days before you were so profoundly ill, my guess is that we would have seen clues in that your blood sugar was getting out of control.
Something was going awry, yes.
As a patient and as a technology expert, what are some of the things that you see in terms of where St. Luke's ought to be going with technology?
So you have the best stuff there. But on a consumer end, there's things that can be done in such a way that it's inexpensive for the hospital, it's inexpensive for the patient, and that reduces cost overall. Like I was saying, this thing's $200. It has GPS in it. My particular one has 4G, so if I'm not around a wireless, I can still send out an email. I've got an app on it that, if I'm going into cardiac arrest, I can hit a button and it pulls up the GPS and it sends out a signal and indicates that there's a problem and it's at this coordinate.
In fact, tell us about the unfortunate event with your friend and how this could have made a difference.
A very good friend of mine, a partner of mine for about 19 years at Hewlett-Packard, died 5 years ago. Same heart attack I had. He was up on top of a mountain, and they spent the time trying to bring him off the mountain on a motorcycle. And had they used their time to coordinate a helicopter flying in, because all of this is line of sight. When you're on top of a hill, you can get the message out. When you go down into the valley, you can't get the message out. And Bill ended up dying because they didn't have the technology in hand. Had he had something as simple as a cell phone, they could have at least coordinated and got some help to him. In the amount of time that it took to get him off the mountain, the helicopter could have been there. And so it certainly, I don't know if it would have stopped him from passing, but it would have been a much better chance than just trying to get him off a hill. And so, we've all seen the commercial, I've fallen and I can't get up. This is the kind of stuff that we need in hand. Especially, you're 18, you're bulletproof, yay, life is good. When I was 18, a friend of mine in high school had a heart attack, and he passed as well. Life is changing. Stress is changing people. And so the quicker we can get information out from a prospective patient to a caregiver, the better off we're going to be. And so it's critical that we do that. And, you know, some people are against always being on. It's an invasion of privacy. You know what? If you're doing what you're supposed to be doing, who cares? There is no invasion of privacy. I don't have to hide. And the fact that I've got technology to help me is a big plus to me. Yeah. And if there was a way, you know, to just throw this stuff to the crowd, I would, because it's that critical. The doctors have to use it, the nurses have to use it, and the patients have to use it. And if the three together are not using it, the communication isn't there, and things don't work.
Courtney, let's open it up for questions. And if you have a question out there, would you raise your hand so we can bring a mic to you? See one right here in the middle, Courtney.
So I actually have a question for each of you. Your recommendations work for very technologically adroit consumers, but we have a population sometimes older, sometimes without access to technology. Do you have any suggestions for helping those patients with communication?
So over the last couple of years, I've been teaching my parents how to use these devices. You know, my dad was an electrical engineer. He designed computers. He wasn't a computer user. And my mom was even less computer savvy. Yet now she has a tablet, my dad has a tablet, and they're loving it. But there is a learning curve to it. It's not just instantaneous. And one of the things that can be done is get people to go to community ed classes. They're available. You know, this technology is cheap compared to the $3,500 I spent on my first computer. This is 1,000 times better than it, and it costs just minuscule compared to it. And so the best way to help those who are, I guess, my seniors, is to just get it into their hands and just say, you know what? You're not going to break it. Now, don't hit it with a hammer, but if you try this app, this is what this will do. Get them playing solitaire. Start them something simple. So, oh, I'm really not hurting this. Does that help?
Thank you. And thank you, yes. And my other question is to David. In your capacity as both an MD and a lawyer, I'm a little concerned about liability risk to email advice. I may be tempted to just dash off an answer. I may not look up the medication list. There may be an adverse drug interaction with the Zolpidem I would give him for his insomnia. How do we deal with the documentation of that kind of medical advice giving?
You know, I won't give you legal advice here, but I'll give you my perspective. And my perspective is, I think physicians more often get in liability issues because things aren't documented that they did. And then there's a difference of what the patient or their family's saying on the stand versus what you're saying. The beautiful thing to me about email is you've got the patient's words right there. And it's documented, it's in your system. From my perspective, I actually think it's helpful. Now, that doesn't relieve any of the normal standard of practice issues that you have to do. You have to know when, just like if a patient was calling on a phone. Is it reasonable to make a treatment decision based on this, or is that unreasonable? Is there something in there that is alarming? And whether it's a phone call or whether it's an email, you have to be looking at that patient's record or putting the things together to make a professional opinion. So I actually think it'll be a net positive. If it goes through my chart, which is how we want you to be doing this, then it's part of the medical record there. In fact, I was looking at, my chart's the best thing since sliced bread.
It's
like
awesome.
And I was looking through my own, and I can still see emails I sent to my physician a year ago.
I was going to comment on that as well. With my chart, I have to log on to your secured network. And so it's not an email that's going through, Gmail or MSN or whoever. It's within your controlled firewall. And so it is protected.
Was there other questions out there from anyone? I'm not seeing one. So let me tell you, you kind of alluded to this before, and unfortunately I'm not technologically adept, and so sometimes my team doesn't give me the credit I deserve. And I've been telling one of my executives we need a St. Luke's app, and he won't give me one. But tell me about, there's a lot of talk about mobile health or m-health. What do you think about where that's going in terms of being able to reach out to patients, being able to better educate them about their medical conditions, allowing them to track their diseases? Where's m-health going?
So we're on the tip of the iceberg. And it's only going to explode from here. The trick is to make sure that you're on the front end of the curve in any kind of technological advance or change. Because if you can be on the front end, your knowledge grows through it as it is changing. My chart is a huge piece to that. And is it the only piece? No. Is it something that could be expanded? Certainly. But it's one of those things that as more patients start utilizing it, it's just going to burgeon for you. It's just, the fact that I can have this in Mexico, if I'm down there, and that's where my former boss was, in Guadalajara, I had access to all my medical records in the States. So if there was a problem, I could say, you know what, I need to go to the doctor. Let me show him what my charts are showing him, what my medical history is. And if he needs to contact my cardiologist in Boise, he can do that. And he can get the direct information so that he can treat me correctly. That's huge. 5 years ago, that wasn't there.
Yeah. I'm curious, in fact, you talked about how wonderful it was that you mentioned 3 different physicians, that they all had your current medication list, et cetera. I'm wondering if Dr. Christensen, was that who you were seeing for your, okay. If Dr. Christensen wanted to refer you to another specialist, how important to you would it be that it's some specialist who's on my chart?
Well, it's huge. It makes it a lot simpler.
Yeah.
You know, I get to a physician that Dr. Christensen trusts. Again, I'm not hip on HIPAA, but it's the law. He can go, Dave, can you sign this? Yep, boom, boom, everything's over there. It's not starting over again every time. That, from a patient's perspective, that's frustrating. Yeah. And from a physician's, I would suppose it's frustrating as well, because you go, well, here's the information, but I can't give it to you now.
Right.
And that's, you know, it's all to protect the patient, but it's not necessarily the best for the patient.
That's great. I'm getting, do we have a question back here?
Hi there, I'm Deb Compton. I'm the director of the Meridian ICU, and thankfully the recipient of this generous gift from Dave and his family. And the one thing that I haven't heard you talk about, and he has set this up for us in the Meridian ICU, are the other not technologies, but the other abilities from the Slate or the iPad, and that's with the iTranslate, and there's a pain scale. My Voice, can you talk about those a little bit, Dave, and tell us how we can help patients with these other apps?
Sure. So
Thank you.
there's Android devices, iOS devices. There's tons of free apps out there. Some of them as simple as the pain scale, where it's like a happy smiley face to this is the worst thing in my life. The patient can poke at it and just say, that's me right there. I'm very uncomfortable. Oh, and I didn't have to say anything because I'm intubated. They get the picture. Okay, this is Boise, Idaho. We have a lot of refugees that come to this area, and English is not their first language. We also have a large number of migrant workers who work on the surrounding farms. English is not their first language. But if a doctor needs to communicate with a patient and it's something as simple as, we need to give you a shot and this is why, yet flows out in English, but they speak Croatian, technically you've got to wait for someone that can interpret. But if you could speak it into this device and have it play back in their language, how important is that? And it's available now. When I was in the ICU, I was just typing things out. It's like, okay, yeah, I'm feeling okay. Can I have some water now? No, you're still intubated. 6 days now with no water. But how important is it to the person who can't speak English? They're afraid. They're going through something that they are not understanding because, the doctor's trying, they're speaking to them, but I don't understand what they're saying. Or the nurse just brought this pill in and, I don't want to take that pill. What is that pill for? Why am I being told to take this pill? Nurse can go, okay, this is whatever the medication is, and this is what it's going to do for you. It's going to reduce the pain that's in your shoulder that was dislocated in your car accident. Oh, okay. Translate, boom. They now understand, or have a closer understanding that it's a painkiller that they're being offered. That's huge. Biggest problem we have on this little blue marble we live on is we don't all speak the same language, and we get frustrated because we get people who are talking, and they may be trying to help, but because we're not understanding each other, it gets frustrating and people walk away and they throw their hands up and we have problems. But with this iTranslate, you can help Mrs. Garcia understand why her son, who, he speaks English because he's grown up here, but she didn't grow up here. She doesn't understand what you're saying. You can help her understand. That's huge. There are other apps. There are tons of apps on different conditions, diabetes, heart disease. Where is this on my body? There's a nurse app that I found, and I showed to Deb, and it's like, here's a whole package, and you got the little pain scale, and you've got this, you can, I want food. When's my food coming? Simple things that would frustrate, a client. And basically, that's what your patients are, is they're your clients. And no one wants their client to go home mad. They want them to go home happy. And the easier the communication is at all levels, the happier people are going to be. The other thing that I wish is, when I went home, I got a big, thick envelope. Okay. Well, what if you just sent me home with 3 PDFs on my little device? Oh, I can just look it up here. Oh, I can search on it. I want to know this. Boom. The information's there. It's quick, it's easy, it's technology that's cheap and available. Utilize it.
That's great. Well, we may have run out of our time, so I'm going to close up here, but I want to tell you there's, you've already heard it alluded to, there's one more part to Dave's story, not only his remarkable patient experience, but the fact that Dave became a philanthropist to us after this. After seeing a problem, identifying the solution, then he and his wife made a gift to St. Luke's of some of these tablets so that we could use them for our patients. And at your table, he further allowed us to utilize that. There's a little card here, has a picture of Dave and his wife, and I understand your wife is here.
Yeah, she's right back there.
Wave your hand. There she is.
There's Valine.
Dave and Val allowed us to make a Christmas greeting card, and it tells a little bit about Dave's story, and he allowed us to make a solicitation in this past Christmas, and we had a terrific response from it. And so I just want to thank you for not only spending your time here with us, but for giving so generously to us.
Well, you guys kept me alive. You know, this is the least I could do, Doctor.
Well, help me join me in thanking Dave. Thank you so much. Really appreciate it. Thanks so much.